All right, Dr. Emer, you're live.
Come on, you're gonna have to come real close. Hey guys, it's Dr. Emer, and I have a patient of mine here today. She's very sensitive, so we're going as slow as we can. We've done extra nerve blocks. She's doing a CO2 laser resurfacing for irregular texture and scarring. This is the first step of a long-term treatment plan for her. We're doing right now the deep portion of the laser called Deep FX. And this is going to remodel over time. She won't see the results from this immediately. This will come over the next 3 to 6 months. But she's going to see a lot of scabbing and redness and stuff over the next couple days to a week. On her, because of her skin tone, luckily, we can go a lot stronger, which is what I'm doing. And this is penetrating at about a 15% density at a 15 millijoules, which is really strong. Can go numerous millimeters deep into the skin. She's concentrating, she's doing so well. But the goal here ultimately is to literally remodel her skin so that it gets an improvement. Most CO2 resurfacings get about a 15-20% improvement, sometimes more for scarring. It's the long-term plan that's really the most important thing in doing constant follow-up. So usually at about 2 months from now or even 6 weeks, we would start doing at least Fractora and or Halo or Fractional for her long-term plan. After a year of doing every few months the laser, she'll do, her skin will be so much transformed. And you see here, if you come really close, you guys, super close, you can see the laser beams go very small into the skin, but they go deep. These are very little channels, remodeling deep collagen. She's doing really well. I'm so proud of her. She's truly concentrating.
Is anybody a candidate for this procedure?
No, this can't really be done on very dark skin. And the strength I'm doing on her is because she has very light skin. You have to have severe scarring or bad wrinkles. What'd you say? You're doing great. I'm so proud. She says it barely hurts, which makes me happy because she's very nervous. We're actually doing pretty strong.
Dr. Emer, could you tell us again which laser you're using?
Yeah, this is the CO2 laser. This is the Deep FX. This is kind of the gold standard laser. Even burn government uses this for burn patients. And this is the deep portion. So we're trying to remodel the deeper layer first. Now this actually hurts a little less than the superficial layer, but I think because she's doing so well, I think she's going to be totally fine. There's always going to be little areas that hurt, and that's why I always tell people, it's all in your mind. You got to concentrate. Think of the end result. Think of why we're doing this, why you came to me, and that's going to make it all that much better.
Is there anything that patients can do to reduce the downtime?
Yes. We can do hyperbaric oxygen therapy, we can do oxygen facials, LED treatment, and a very aggressive skincare protocol, which we're going to be doing for her, which she's already ready to go. So we've been able to take, and also we're going to add PRP, which also can decrease the downtime significantly. That's growth factors from your own blood.
How many passes do you do, or is
well,
it?
This one, we're only going to do one pass. This is very deep and strong. But for the other one, we're going to do one as well, but on top of this one. Really good. I'm very proud. Okay, so now we're gonna have her, you can see all the area treated. Turn all the way left for me. And if you need to, you can use some of the Pronox. We're using Pronox right now as well, which is a nitrogen oxygen combination. Rosa. That was fun. So you did great. One side's done. We're now moving on to the other. Zoom in on there and show everybody the columns. Get close so you guys can see and get even closer. Beautiful. Doing so well. Very. She's doing great. We're following that pattern. Doing what we call the total FX, which is this, where we do both the deep and the superficial. Gives you a little bit more coverage. Just takes a little more time, but all we care about is good results. So you guys, we're gonna finish up. She's doing phenomenal. We will be back to show you the active FX in a few minutes.